environment is the physical and socio-cultural setting that one lives in.
An external environment is the world that exists beyond one's own control and beyond the borders that separates oneself from everything else.
The external environment has a heavy impact on healthcare organizations. All healthcare organizations are influenced by the larger world that they exist in.
A good manager knows and understands that in order to run a successful business and organization, they must be connected with the external environment. Managers that develop good relationships with socio-cultural aspects of the external environment are more successful.
To truly understand a healthcare organization, you must understand the environment that it resides in, because that particular environment will strongly affect it.
Richard L. Daft is a professor of management who created the 10 distinct sectors that make up the environment.
First sector, the industry sector. This relates to other businesses and competitors that will impact HCOs. The industry size and competitiveness of industries and the environment will also play a role in influencing HCOs, and managers of HCOs feel the pressure to remain competitive in the market and to succeed.
2 is the raw materials sector. This includes suppliers, manufacturers, real estate, and services. Healthcare organizations must always be researching to make sure that they are using the most cost-efficient suppliers and manufacturers, as well as keeping their organization in the most money-producing location. Importing different materials from other countries for cheaper options is an example of raw materials.
Sector 3, the human resources sector. The human resources sector would include labor market, employment agencies, universities, training schools, employees in other companies, and unionization. Managers of healthcare organizations must be making sure that they are well aware of their employees and the environment surrounding them. Managers should be aware of the labor market to make sure that they are hiring the most qualified employees and recruiting from the top-ranked universities and top-ranked schools. They should always be making sure that their employees are content and working hard for the organization. Healthcare organizations should be comparing themselves to other organizations in their field to make sure that they are remaining top-ranked and competitive.
Sector 4, financial resources sector. This includes stock markets, banks, savings, loans, and private investors. Managers must learn how to choose the methods that are most cost-efficient while still being effective. Money, lending, financing to hospitals and long-term care from banks to help get started and maintain functioning.
Is market sector. Customers, clients, potential users of products and services are all part of this. Managers of healthcare organizations must always remember that they are providing a service to the patients, which are the customers.
Technology sector. Techniques of production, science, computers, information technology, e-commerce. Technology is always advancing, and for HCOs to stay relevant, they must keep up with the changes. Technology can make the processes of the HCOs more efficient. HCOs must make sure that they are always stocked with the leading medical equipment so that they are considered a frontlining organizations to consumers. Electronic medical records are replacing paper records and making everything more efficient. In-home medical care creates less need for patients to come into the office, and doctors are able to reach them at home.
The economic conditions sector. The economic conditions sector, it would include recession, unemployment rate, inflation rate, rate of investment, economics, and economic growth. It is crucial for managers of healthcare organizations to understand the market that they are working with. They must keep a competitive price for their services while not being overly expensive and therefore unreasonable.
Government sector. This includes city, state, federal laws and regulations, taxes, services, court systems, and political processes. Understanding that healthcare policies are always changing, and you must be prepared to handle those changes. Also, knowing local policies and state policies is very important. Understanding the community that the HCO is located in, and managers of HCOs should be aware of presidential policies. Example of policy is Medicare cutting funding to hospitals that are having too high levels of readmission.
Number 9 is socioculture. Age, values, beliefs, education, religion, work ethic, consumer, and green movement are all part of this sector. We must understand that managers must deal with people as people, and things can't always be handled through the bureaucracy. Barriers to culturally sensitive intervention in a multicultural area is an example of this sector.
International sector. Competition from and acquisition by foreign firms, entry into overseas markets, foreign customs, regulations, and exchange rates. Understanding how the United States healthcare compares to other countries' healthcare systems. Understanding that some care, research, medical service will have to be outsourced, and that many U.S. medical providers or healthcare policy directors travel overseas to provide service. Understanding that many people from different cultural backgrounds and countries will be needing services from HCOs, and they must learn how to be accommodating.
These are the 10 sectors that make up the external environment that influence healthcare organizations. Thank you very much.
Thank you.